Hello everyone, welcome to Let's Talk Shop. My name is Debbie DiMartini, certified clinical thermographer with Thermal Body Scan in Santa Cruz. Today I'm actually going to give you a story about a patient that I helped many years ago, and this story actually is one that I tell often because I think that it shows some real insight to the benefits of adding thermography to any normal health screening procedure that you'd be going through. So this particular patient was a lady that I saw when I worked up in Washington, and she was actually referred to me for a full body scan by her acupuncturist. And she was seeing an acupuncturist because she had many conditions, but the most prevalent symptoms that she was suffering from was she had diabetes and she had neuropathy in her feet. Certainly, if you have diabetes, you're familiar with what neuropathy is. If you're not familiar, neuropathy is a nerve condition that occurs. There are multiple things that can cause it, but one of the most commonly seen causes is what we call diabetic neuropathy. And what happens is the vascular system in the lower limbs begins to malfunction. It doesn't work as well as it should, and that has to do with nerve complications that are caused by complications with diabetes. And so with patients with neuropathy, they usually have numbness, tingling, they can have pain sensations in the lower limbs, sometimes the hands as well. It usually affects the outer limbs. In this particular patient's case, she was having neuropathy symptoms in her feet and lower legs, about mid-calf down. So anyway, getting back to thermography, we did a full body scan for this patient as an intake for her acupuncturist so he could look at what was going on with her. And what was interesting was that with neuropathy, we typically see a cold pattern or a hypothermic pattern. And the reason for that is that the nerves are no longer controlling the blood flow to those areas of the skin. If you have inflammation, there's a lot of blood flow, swelling, you'll see red and hot images, hyperthermic. When you lose blood flow, whether it's a cardiovascular issue or a nervous issue that's causing it, you will have hypothermia, so cold patterns. So when I did her scan, I was really surprised to see that, in fact, her feet looked very hot, very hyperthermic. It was not at all the pattern that I expected to see, having had a diagnosis of diabetic neuropathy for many years. The point that I'm getting here is that this particular patient had been diagnosed incorrectly. Yes, she had diabetes, but the problem that was happening in her lower limbs was not diabetic neuropathy. When we got her thermography report back by the interpreting physician, it was in fact MS. So this patient had multiple sclerosis that she was unaware of, had had it presumably for years, and she had been misdiagnosed. Yes, she had diabetes, and so the conclusion that was made was that she was having diabetic neuropathy, and that was the problem with her feet, but in fact it was something very different than that. The point here is that you've got to make sure that, number one, you're treating the right thing, right? You don't want to deal with a misdiagnosis. This person had been treated for years incorrectly. So let's make sure that we are attacking the right problem. But to further that, thermography is great to use as a visual proof of your treatment effectiveness. Are the treatments that you are doing, whether it's physical therapy, acupuncture, chiropractic, massage, drug therapies, there's lots of different therapies, are those things working? If they're not, you need to figure out why. And certainly if you've been misdiagnosed, you could treat something wrong for years, which is unfortunately what had happened with this patient. So just an interesting story that I tell often because it's shocking, and I could tell you hundreds of stories just like that, and I may continue to tell you some stories as we progress with my blog series. But in the meantime, I urge you to check out thermography. It's safe, it's painless, it's proactive, there's no radiation, nothing touches you, you don't get in a tube. So please check out my website, www.thermalsc.com. My name is Debbie DiMartini. Thanks for joining me, and I'll see you next week.